Well, welcome to today's brief presentation on IDEXX microbiology. So we're going to briefly discuss microbiology at IDEXX and then also talk about the microbiogram to give you a little bit more information on that. Microbiology is important. We'll talk about, if you've got something like a urine sample or an ear sample where you're concerned about an infection, finding out what that infection is specifically and a sensitivity is really helpful with antimicrobial stewardship. So we can try and ensure that we're using the most appropriate antibiotic for the situation that we're in. We're going to touch on microbiology at IDEXX and what's the difference, and then talk about the IDEXX microbiogram. A couple of things that are important to remember. The most common sample that we see in the laboratory for microbiology is urine. Urine is plated out at the receiving laboratory. So we have our core laboratory in Brisbane, but we have day laboratories in Sydney, Melbourne, Adelaide, and Perth. And if you're submitting a urine culture that goes to one of those labs, it's plated out at that lab. If there's no growth at 24 hours, you get an interim report and a final report at 48 hours if there's no growth. If there is growth on that overnight incubation, the culture plate goes to our Centre of Excellence at Brisbane, where further processing is done with that. But it's already growing when it's on its way to Brisbane. With the equipment that we have in our Centre of Excellence for identification of bacteria, we have what's called a MALDI-TOF, which is matrix-assisted laser desorption ionization time of flight mass spectrometry. Now, don't worry, we're not going to ask you to repeat that back at the end of the presentation. But what the MALDI does is it does all our identifications of bacteria and fungi in the lab. It can do this identification in minutes with that. So it's very quick with that. It's also very specific with its identification. Back years ago, before we had the MALDI, using sort of different culture techniques and biochemical testing, we could identify organisms to a certain level. We could be much more specific about it down to the species level now using the MALDI. And it's got a database in there of thousands of organisms. And that's because we have a number of MALDIs globally, and IDEXX has a large database of organisms in there. So it's really giving you the most specific and accurate identification that we can, and more precise than doing that manually. When it comes to bacterial sensitivity determination, I'm sure you all remember at vet school in our microbiology classes, the Kirby-Bauer method. So, the plate gets covered in the organism, you put the discs on, and you're looking at the zone of inhibition around it. And, you have the things that you sat over it to look to see if it was an adequate zone of inhibition, because the size varies from organism to organism with that. So it's the best we had, takes a little bit of time to do. But now for the vast majority of our sensitivity testing, we're using what's called a Vitek 2 analyzer with that. So with that, bacterial colonies are suspended in a fluid, and then that diffuses into a card with a number of antimicrobials in that card. So it's giving us much more precise identification of what antimicrobials are sensitive. It's quicker, and we get a sensitive, intermediate, and resistant result with that. One difference is, there are a number of laboratories, that have the Vitek 2. One difference at IDEXX is that we have panels of antimicrobials in the cards that are specifically developed for IDEXX. So we're doing that with veterinary specific agents that you're going to have in your clinic. So rather than a list of things that you probably don't have within your clinic situation, we're using veterinary specific drugs so that it's going to give you relevant information for the patients that you're seeing in your clinic. And this is what a report will look like. So for example, this is one for urine. It will give you a colony count, so giving you the range of organisms that are in there. Gives you some information about the sample. Was it a cystocentesis? Was it catheterized? Was it voided? Because that influences how we interpret the results with that. And then you'll have the list of drugs, and we're reporting a list of, ideally first or second line drugs, and giving the sensitivity with that. One thing that's also important to remember at IDEXX is if you have any questions about the microbiology results, we have our medical consulting service who's available. You can either ring our call centre or make a request through VetConnect Plus, and one of our medical consulting team can give you a call back and give you specific advice for that patient. So when they can hear about the history physical exam, the clinical details of that patient, they can help interpret the culture result and help make decisions about what the most appropriate therapy is going to be. Just to finish off, also want to touch on the IDEXX microbiogram. So what the microbiogram is, it's an antibiotic surveillance report that's compiled by IDEXX from results of urine sensitivity testing at samples coming from our laboratories across Australia with that. If you have submitted a microbiology sample to IDEXX, you will automatically get this report. If you don't, let your veterinary diagnostic consultant, so your account manager, know, and they can organise that you receive those results. And that's provided to you at no cost. So what this report is going to have is, at a state level and a national level, what are the three most common urine isolates that you get, both state level and national level. And then for each of them, what are the most sensitive drugs for that particular organism, and the drugs that have had the most resistance with that. Now, this is not in any way, shape, or form replacing doing a culture and sensitivity on that urine sample. But what it's doing is giving you a bit of a clue up front of what is the most suitable empiric choice on that. So, for example, if you look at urine sediment and it's rods in there, well, potentially, if that's one of the more common ones in your area, E. coli might be the choice. So this can give you a sense of what's most sensitive that you can use for empiric therapy whilst you're awaiting your culture and sensitivity report. And as we said, if you've submitted microbiology to IDEXX, you should automatically receive one of these reports. So hopefully it's been a pretty brief run through microbiology at IDEXX, but hopefully that's given you some information on that to understand, what we're doing with our cultures, the technology behind that. So, with the MALDI, really rapid identification, with the VITEC, precise identification of sensitivities with veterinary specific drugs, and then the microbiogram that can help you with those empiric choices whilst you're waiting on your culture and sensitivity results. If you have any questions, don't hesitate to reach out to your veterinary diagnostic consultants, or reach out to me, and we can try and answer any questions for you. So thanks for joining us today, and hopefully we'll see you soon at another education session. Thank you very much.